We are back right now with the Problem Solvers Health Alert on colorectal cancer. Excluding skin cancers, did you know colorectal cancer is the third most common cancer here in the U.S.? Listen to this. 1 in 23 men and 1 in 25 women will be diagnosed with colorectal cancer, with the American Cancer Society projecting more than 100,000 new colon cancer cases this year alone. Here to discuss a new study that is getting a lot of attention all across the country and the importance of screening is the author of the study and the chief of the Gastrointestinal Division over at Denver Health, Dr. Jordan Karlitz. Dr. Karlitz, thank you for being here. Let's start with this study. One thing that I found very interesting here, you found that more young people are getting diagnosed with this disease. Why in this cancer?
Right, not even just diagnosed, but they're actually getting diagnosed at advanced stage, so meaning metastatic disease. So the younger people get, the more likely they are to present with metastatic disease, which means that it's spread to distant parts of the body. And people in their 20s and 30s had actually the largest increases in the rates of distant stage disease over the past few decades. And when we looked at certain races, the non-Hispanic black population and Hispanic populations had a disproportionately higher burden of increase over time in metastatic cancer.
When I hear people with 20s and 30s with metastatic cancer, it sounds very alarming and very shocking to hear. What do you want to see people do to help get this treated and to help get it caught early?
Right, well, there's a few things you could do. I mean, number one is you want to get screened on time. So the new screening age has moved from 50 to 45. So we definitely want people to get screened on time at 45. But if you have concerning symptoms or a family history of colorectal cancer or even other cancers, you may actually have to undergo testing well before age 45. So we want patients to have a dialogue with their primary care providers to discuss symptoms and discuss their family history so they could get risk stratified before age 45 in case they need earlier testing, and to get screened on time at 45 if they're so-called average risk.
What are some of the symptoms that you're talking about that people might notice and they say, hey, I need to go tell my doctor about this?
Yeah, one of the important symptoms is rectal bleeding. So if you're seeing blood in your stool or a change in bowel habits, abdominal discomfort, I mean, obviously some of these symptoms could overlap with other disorders, but you definitely want to discuss all symptoms with your primary care doctor. And again, like things like rectal bleeding, you know, definitely raise red flags.
Absolutely. I know a lot of people don't like to talk about it. They may be concerned or a little bit worried about going to the doctor. What does the screening entail? The easiest way you can say it?
You know, basically, again, talk to your provider, make sure you get screened on time at 45, and there are different options for screening. So there's colonoscopy, there's stool-based options, and even some other options as well.
Are you starting to see more people get screened now? Are we going in the right direction?
Well, I would say that screening rates have increased over the years. In Colorado, the screening rate is actually 69%. But the goal for the United States is to get 80% of people screened. And when you start talking about people in kind of the lower age range, meaning people like in their early 50s, the screening rate could be below 50%, and that is definitely not optimal at all.
No, and if you talk about, you know, Colorado at 69%, that means 31% of people are not getting screened, and therein lies the problem here,
and that 69% is all people over age 50. But if you start looking at people like in the 50 to 55 range, like on the younger edge of that, it's below 50%.
Okay, it's good information, Doctor. We appreciate it very, very much. It's going to make a difference.